So in this video, I'm going to demonstrate the technique for taking a blood pressure. Before I start, I'm going to introduce myself, check the patient's details and gain consent for the procedure. Hiya, I'm Lucy, I'm one of the nurse practitioners here. I've come to take your blood pressure today, if that's okay.
Sure.
Can I just check your name, address and date of birth before we start, please?
Yeah, name is Daniel White, address is 2 Hill Close, St Austell, and date of birth 28th June 1976.
Excellent, thanks very much for that. So Dan, if it's alright with you, I'm going to take your blood pressure today, if that's
Sure.
okay. I'm just going to wash my hands before we start. And I'm just going to make sure I clean my equipment. I'm just going to clean my stethoscope. So for those of you who have limited experience in taking blood pressures, this is the equipment that you will want to either purchase or have access to for practicing. So you need a stethoscope and a manual spool. So I'm just going to lay this one out so I can clean the cuff. Now, in lots of practice areas, we've got automated blood pressure machines. They're great, but if you've got a patient who's got an irregular pulse, or if you have an inaccurate reading, or just if your machine's broken, you will need to be able to do a manual blood pressure. They are more accurate. So this is why we want you to perform this in your OSCE examination. Okay, so to start with, you just need to make sure that you have the correct size cuff for your patient. So you can see here, we've got an artery marker on the cuff, and we've got a line here. That artery marker needs to come within that line when it goes down your patient's arm, and that indicates that it's the right size cuff for your patient. So Dan, I'm just going to place this on your arm if that's okay. Do you have a preference in which arm we use?
No, it's fine.
Okay. It's always worth checking that just to make sure that there's no arm pain, trauma, or if your patients have previous surgery, which means they've got lymphedema, it means that you can't use one of their arms to take a blood pressure. So if I could just ask you to pop your arm up on the table for me. Sure. So you get your patient to rest their arm on a table or pillow just so they're relaxed, and they're not tensing their arm at all, so again it won't give you an inaccurate reading. Making sure that there is no clothing in the way, or if it is, it's removed and just rolled up out of the way so it's not again going to impede your cuff and give you an inaccurate reading. So I'm looking at placing this artery marker over the brachial artery, so I'm just going to feel for that. I'm using the crease of the arm with the antecubital fossa. We're looking at kind of about 2 centimetres above this and slightly on the inward line, and you should, around this area, be able to feel the brachial pulse. So again, using your 2 fingers like we did for the radial pulse, and just feeling around this area, just pressing lightly to begin with, and then a bit more firmly if you need to. And I can feel the brachial pulse right there. So that's where I'm going to place the artery marker. So again, it's about 2 centimetres up from the antecubital fossa, over the brachial artery. I'm just going to put this cuff all around. Being mindful of clothing in the way, as I said, making sure that's removed. And I'm looking for the artery marker to be within these 2 lines here, which indicates it's the right size cuff for my patient. So if you had a cuff that was too big or too small, it could give you an inaccurate reading. So what we're going to do now is we're going to estimate the systolic blood pressure. So you have systolic and diastolic blood pressure readings. And more information of this, what this means, can be found on the clinical skills information in the OSCE section on Blackboard, if you want to read into this further. So we've got the pump here, you've got the gauge and the spig, and you've got the pump at the bottom, and you've got the dial on the side of the spig. So I'm going to find the radial pulse exactly like we did when we did the pulse earlier. So I'm just using 2 fingers, just a couple of centimetres up from the base of the thumb. You should be able to locate the radial pulse there. I can feel that nice and clearly. I'm now going to ensure the dial, the bevel is shut. I'm now going to pump up the cuff, just explain to my patient that it's going to get a bit tight around their arm, just for a moment. I'm just going to pump it up nice and slowly, and so I can no longer feel that radial pulse. So you've got markings all the way down the side of the gauge in 20 millimetres of mercury markings all the way down the side. So I'm pumping it up slowly each time. So I've got to 130, I can no longer feel that radial pulse. So I'm going to release all of the air, so it's no longer just uncomfortable for my patient. And I'm now going to take the blood pressure. So I've got that estimated systolic reading. What that means is now I can pump up the cuff again to 20 millimetres of mercury above that estimated systolic reading. So I can pump it up to 150 millimetres of mercury, and then I should be able to take the blood pressure accurately. If you don't estimate the blood pressure, you could have to pump the cuff up too high, causing unnecessary discomfort to your patient. Of course, if you know your patient well, if you've got recordings written down already that will tell you what their blood pressure normally is, you might not need to do this. But for the purposes of the exam, this is how we want you to demonstrate taking your patient's blood pressure. So I'm just going to take my stethoscope, ensuring that you put this in your ears the right way round. So the earpieces need to go in your ears, pointing forwards to the end of your nose. If you put the earpieces in the wrong way, pointing backwards towards your ears, you won't be able to hear anything at all. So I'm going to point these in forwards to the end of my nose. At the end of the stethoscope, you've got a diaphragm and a bell. The bell is the smaller part, the diaphragm is the larger part at the end of the stethoscope. If it's pointing the earpiece in the right way and you tap the diaphragm, you can hear quite a loud noise there. If you're still unable to hear anything, on some stethoscopes you're able to turn them around just at the bottom here. So if it's still quiet, it's worth just seeing if your stethoscope is one that turns around at the bottom. Not all do these, but it's just worth bearing in mind. Now we're going to use the diaphragm end to take the blood pressure. So we know roughly where that brachial artery is. We have our artery marker on it. So I'm just going to fill in that area again. And fill the brachial artery there. So I'm going to just place the stethoscope on the arm. I'm going to hold it in place with my thumb. I'm going to take the spig here, making sure that the dial is now shut. And I'm going to pump up again, so it's just going to get tight around your arm again there, Dan, alright? So I'm going to pump up to 150 millimetres of mercury now, so it's 20 millimetres of mercury above this estimated systolic reading. Just pumping up that. Now I'm going to release the bevel on the side of the gauge. I'm just going to release that really slowly. It's going to go down. Each of the little markers on here a count of 2, so I'm just going to release that down slowly every couple of seconds. It's just releasing a little bit of air out of that cuff. And I'm waiting to hear the sounds. So I'm waiting to hear a dub, dub, dub sound. The first time I hear that sound, I'm going to make a note of when I hear it, and that's the systolic reading. So at 118, that's when I first noticed that systolic, the first dub, dub, dub sound, so that's the systolic blood pressure reading. I can continually hear now dub, dub, dub sounds all the way down. I'm releasing this bevel slowly, and when I stop hearing those dub, dub, dub sounds, that's the diastolic blood pressure. So that was at 62, I stopped hearing that sound, so I can now release the rest of that air out. Okay, go and move the stethoscope. So what I was hearing there was releasing the air slowly from 150, was releasing it really slowly, watching that gauge all the way round, and I was waiting for a dub, dub, dub sound. When I started hearing that dub, dub, dub sound, I've made a note of that number. That's the systolic blood pressure. And then as I continue to hear those dub, dub, dub sounds, releasing the air ever so gently and slowly. And then when you stop hearing those dub, dub, dub sounds, that's the diastolic blood pressure. So Daniel's is 118 over 62. So that was perfectly within normal range. That's good. That's what we were expecting. I can remove the cuff now. I can clean all of the equipment again. Wash my hands, and that's concludes the blood pressure taken. So as I said, there's lots more information on the Blackboard site under the OSCE tab. It gives you a lot more information as to what the readings mean and what the parameters are for the blood pressure, the temperature, pulse, and respirations as well, if you're interested in reading those.